Breathing is something we rarely think about until it becomes difficult. Imagine feeling short of breath doing everyday tasks, like climbing stairs or even talking. That's what people with chronic obstructive pulmonary disease, COPD, experience daily. COPD is a long-term lung disease that makes breathing harder over time. It happens when the airways become damaged, inflamed, and blocked, making it difficult for air to move in and out of the lungs. Imagine breathing through a narrow straw. It takes more effort, and you never feel like you're getting enough air. That's COPD. In a healthy lung, the airways are open and flexible, allowing air to flow in and out easily. COPD includes two main conditions. One, chronic bronchitis, a long-term inflammation in the airways, causing constant mucus production and a persistent cough. Two, emphysema refers to damage to the tiny air sacs, alveoli, in the lungs, making it harder for oxygen to get into the blood. Most people with COPD have a mix of both conditions. The number one cause of COPD is smoking, like cigarettes, hookah, marijuana, passive smoking. 90% of COPD cases are linked to smoking. Air pollution and dust exposure, as long-term exposure to smoke, dust, or chemicals in workplaces. Genetics, like alpha-1 antitrypsin deficiency, which is a rare genetic condition that makes the lungs more vulnerable. Frequent lung infections in childhood as weakens lung function over time. At first, COPD symptoms are mild and easy to ignore, but they get worse over time. Early symptoms include shortness of breath, especially during exercise, chronic cough lasting for months, excess mucus production, frequent colds or respiratory infections. Later symptoms include severe breathlessness, even at rest, wheezing, which refer to whistling sound when breathing, tiredness and weakness due to low oxygen levels, chest tightness, unintended weight loss. COPD does not come suddenly. It develops slowly over years. If you have persistent cough, breathlessness, or a history of smoking, your doctor will check for COPD using these tests. Spirometry, for lung function test, measures how much air you can inhale and exhale, which is the gold standard for diagnosing COPD. Chest X-ray and CT scan that shows lung damage and emphysema. There's no cure, but it can be controlled. COPD is a progressive disease, meaning it gets worse over time. But good management can slow down progression and improve quality of life. Quit smoking. This is the most important step. Stopping smoking won't reverse the damage, but it prevents further lung decline. Even cutting down helps, but quitting completely is best. Medications such as bronchodilators that help relax the airways and make breathing easier. Steroids that reduce inflammation in severe cases. Antibiotics that treat infections that can worsen COPD. Pulmonary rehabilitation, as breathing exercises and physical activity can improve lung function. Oxygen therapy. When oxygen levels drop too low, patients may need oxygen support at home. Healthy lifestyle. By eating nutritious foods, stay active. Stay away from lung irritants, such as pollution, smoke, dust.